So the question I often get asked is, how do I prepare for a knee replacement? And how long is it going to hurt after I have a knee replacement? When can I go back to doing my normal things? So pain and preparation for surgery are complicated, and not all of these answers will apply to everyone. But in general, the things that lead to bad outcomes in knee and hip replacements and surgeries are being out of shape and being afraid and not having a good social support system afterwards. So before a knee or hip replacement, here are the things you can do. First of all, there have been a lot of studies looking at the exercise routine. Fortunately, they used to think that you needed a really intense strengthening and practicing the activities of daily living regimen. Now it seems that the intensity doesn't necessarily make that much difference, so long as you're doing some kind of exercise program for 2 weeks to a month before you're going to have your knee replacement. The second thing is that the plan for pain management should also include taking some supplements and making sure that your magnesium level is good before surgery. About 64% of people are low on magnesium, and magnesium is an anti-inflammatory. It is a smooth muscle relaxer, and it also amplifies the effect of opioids, so you don't need to take as many during and after surgery. So between 3 and 5 days before surgery, so long as your doctor says it's cool, think about taking 250 to 500 milligrams of magnesium a day. Other critical thing before having any kind of surgery is to make a pain plan, because there is an expected amount of pain that we'll talk about, and if you don't have a plan for coping with it, you're not going to feel like coping with it afterwards. So making a plan beforehand is really important. About 20% of people feel social isolation after a knee or hip replacement. So try to make sure that you've got people lined up who will come for short visits. Try to make sure you've got a list of phone numbers and people that you're going to talk to for 5 or 10 minutes after your surgery once you get home. But do what you can to avoid social isolation.